a series of insightful webinars where we will have experts from across Europe sharing their hands-on experiences in implementing antimicrobial stewardship and infection prevention and control in animal health sector. This just briefly introducing that this will be an open space for everybody to discuss and to exchange knowledge, share experiences, and so on. So we will have a time after the presentations for you to participate. You can raise your hand or you can write in the chat and we will go through them. But preferably, if we can talk, that will be fantastic. So Isaura, myself, and other colleagues in this work package 6.2 and 7.2 are very happy to have Els Broens as our first speaker. She is Associate Professor at the Faculty of Veterinary Medicine in Utrecht University in Netherlands. And she's given the Veterinary Microbiological Diagnostic Laboratory, and her research focuses on antimicrobial resistance and stewardship. And today she will present the outcomes of the antimicrobial stewardship and pets project that she's performed in the Netherlands. So Els, the floor is yours. Welcome, and
yeah,
you're gonna start.
Thank you so much, Maria, and I'm honored that I am the first one doing this Voices from the Field thing, and I hope a lot of our partners or stakeholders will join and do other and share their experience. So so my talk will be on antimicrobial stewardship in companion animals, and as you said, we did a project and we are still having another project now, which I will talk about. But first of all, I would a little bit of background. We have this regulation. I think we're all aware of this regulation on veterinary medicinal products, and that has some consequences for us. And if we look at stewardship and antimicrobial, reduction of antimicrobial use, I think their focus has been on livestock lately, most of the years, and there's actually limited data and actions and results in companion animals yet. But we have to realize that there's a close contact between companion animals and humans. And then at the end, this is just a short introduction on these things. I will talk mostly on our project to see what we have been doing. We are all aware of this regulation, and this legislation is not only applicable for livestock, but also for all animal species. Which means that we have to, all EU countries, member states have to report antimicrobial use data for all animals. Well, for now it's only cattle, pigs, chickens, and turkeys, but other animal species will follow. And by 2030, all member states have to report also the use for dogs and cats. So I think all member states are busy trying to implement this. But it means that we will get more data, and that's a good thing, I guess. So, what do we know actually on data on companion animals? The Assoc, so the European Surveillance for Antimicrobial Consumption, they have a report every year, and if you then look for companion animals, what they did is look at the overall sales split by tablets, and then assuming that these are mainly used in companion animals. So this is a very rough estimate, of course, but maybe the best guess we have at this moment. And if you then look at this table, and maybe it's too small you can look it up online, but at the bottom you see for the total of the 31 countries who have been reporting their sales, you see that 1.6% of the total sales is tablets, and it varies from 0.19 in Spain to 9.7 in Finland. And in the Netherlands, it's 2.4%. And it varies a lot because it depends, of course, on how many tons you use in other animals. So if it's very low, like in Spain, it doesn't mean that it's less in kilos, but it's percentage, of course, relative to the total use in animals. And I think what I put in blue here is that you have to realize, as I said, it's a very rough guess, because these data are not normalized by the biomass of animals that could be treated, as population data of companion animals are not available for most countries. So it's not like a population correction has been done on this, but just a guess. What more do we know? Well, what we also see in this Assoc report is that the top 3 of what is used, and this is again, this is the proportion of tablet sales. So tablets that are sold, and then if you look at the different in the graph, you look at the different colors, and you see that the light blue color or greenish color is the biggest, and that is penicillins. That's about 50% if you look at for the average in the different countries. And these are all extended spectrum, so not small spectrum penicillin, but ampicillin or amoxicillin. And 94% of them is with beta-lactamase inhibitors. So I assume that will be amoxiclav for most of it. So we know that we use a lot of amoxiclav. Then the second, what we use is first and second generation cephalosporins is about 20%. And then macrolides is the next one. So that's the top 3. And these are all in the category from the IMA-AMEG category C. So not in D. So it's the second, what we call in the Netherlands, the second choice. So that's just for you. Okay, maybe it's the use is low compared to livestock, but the choices could be optimized, I guess. I looked for some countries who actually do have some more data on companion animals, and I found this in Denmark, this data from 2021. And they looked at products that were registered for pets, so dogs and cats and horses. So it's together. And what they saw from 2012 to 2021, that there was an 8% increase between 2017 and 2021, where I think we are all aware that in livestock we only see decreases. And also they say that a large proportion for dogs and cats is used for chronic or recurrent diseases. The use of fluoroquinolones in companion animals was 19% of all fluoroquinolones used in Denmark. And the use of cephalosporins was 60% of all cephalosporins in Denmark. And if you look at the 3rd and 4th generation cephalosporins, it was only used in companion animals. So again, I think that we can say that the antibiotic classes could be optimized. So we had also limited data in the Netherlands, where we looked in the Dutch data from 2009 to 2014, where we asked 100 veterinary practices to give their sales data. And there you see that there was a decline of antibiotic use between 2009 and 2014. If you look here at the y-axis, there are 0 till 4. I will explain later what that is. It is a defined daily dose, but I will come back to you on that, on how we calculate those. But what we also have seen is that there's a large difference between practices. And again here, that amoxiclav and first generation cephalosporins, which is the yellow in the bars, is about 40% of the use. And the red one, so which is fluoroquinolones and 3rd and 4th generation cephalosporins, was approximate 7%. So it was not that high, but again, amoxiclav and first generation cephalosporins is the most used. So concluding on the limited focus and data on companion animals, I think there's the central registration and quantification of antibiotic use is lacking in most countries nowadays, but in 2030 it will be better. We can also say that there's relatively low antibiotic use if you compare it to food-producing animals. It's 1.6% of total use. Be aware, this is tablets, kilogram active substance, so not population corrected. We see no or small decline in antibiotic use compared to food-producing animals, and we also see a relatively high use of critically important antimicrobials. So I think if we want to focus, do stewardship in companion animals, focus should be primarily on quality and appropriateness, and maybe less on quantity. As I said in the beginning, there's a close contact between companion animals and humans. There was a study done in Belgium where they did a survey, and about 98% of owners indicated at least one of the highly intense interactions like licking hand or faces. And 30% of them said that the dog slept in their beds. So resistant bacteria are widespread in companion animals and transmission back and forth occurs. And well, if you look up PubMed or whatever, you will find several papers where there has been spread of ESBL or MRSA within households. So we know that it occurs. So antimicrobial stewardship, well, I put a definition here. I know there are very different and many definitions. And of course, we are looking now in our subtask for the core elements. And what I think the most important is that it's a set of actions and it's not just one thing, where we promote using antimicrobials in ways that ensure sustainable access to effective therapy for all who need them. And if you want to say it in lay language, it's as little as possible and only as much as necessary. So now coming up to our Dutch example, where we did this project, and Nonke Hopman, my colleague, she was the PhD student working on that, and it was a grant from our health organization that we did that project on. So, and what were the objectives? So the objectives were to develop, implement and evaluate the effectiveness of an antimicrobial stewardship program in companion animal practices, with the sub-objectives to increase awareness on antibiotic use, to decrease total antibiotic use whenever possible, and to shift antibiotic use towards category D antimicrobials. So from category B and C to D. So and what we did is we did qualitative research first with interviewing companion animal veterinarians and a survey among veterinarians. Then we quantified, or we developed a quantification method for antibiotic use. We looked for the baseline data in the participating clinics. So we had 44 clinics participating, and we looked at what was the data before we were there, before we implemented our stewardship program, and then we developed and implemented and evaluated this program, and I will talk you through it. So first of all, I said we had the qualitative research, or we interviewed companion animal veterinarians to look for factors influencing antimicrobial prescribing by Dutch companion animal veterinarians. And if you look at the outcomes, and well, here, this is a conceptual model of factors influencing antimicrobial prescribing behavior. The veterinarian is in the middle because, of course, the veterinarian is the one deciding whether he or she wants to prescribe antibiotics, yes or no. And you see there are patient-related factors, like, of course, what is the illness? What are the clinical signs? Is it a dog? Is it a cat? Is it an old dog or an old pet? Or, but it's also owner-related, because there was a lot of factors that people said, of the veterinarians said, that owners were giving them pressure, that they wanted antibiotics or a quick fix or things like that. So these are important factors. Then there's also treatment-related factors. Is, of course, are there any alternative treatment options, yes or no? So like for skin disease, can you do like a shampoo or not? But for like a cystitis, there are no alternative treatments, so you need antibiotics. So, and then there's also, if you look at antimicrobial related factors, it's more like the choice of antibiotics. If you have chosen, yes, I need an antibiotic, then is it in tablets, is it capsules? Do we do it 2 times a day, 3 times a day? So this can influence which antibiotic you choose. And of course, there are more, well, environmental factors, contextual factors, like I think we all are aware that on Friday afternoon, the number of prescriptions are higher than on Monday morning, just because you don't want to get the dog back in your weekend when you're on call. So, or just to make sure. So that's, I think, if you look at that, that's one of the things. But also, if you have a colleague who's very, well, I said, we always do it like this in this practice. If you're the younger one or whatever, that can be, of course, an interaction as well. Like if your older colleagues said, this is what we do, we always prescribe a week long of this, then you have to stand up. And some veterinarians are very good in that, and others are very are not that good at that. So there are a lot of factors influencing prescribing behavior. Following, we did a survey among Dutch companion animal veterinarians on attitudes and perceptions. And what we there saw is that antimicrobial prescribing behavior appears to be well considered. That was what came out of the survey, and not influenced by economic drivers. So where there are studies done in livestock where economic drivers were came out as one of the factors, but in this survey, veterinarians said that was not the case. Again, the owners were very. They came out here that they were the unwillingness and financial constraint of owners were perceived as important barriers for performing further diagnostics. And antimicrobial prescribing behavior was influenced by many factors, and so. Well, the conclusion, and maybe it was an obvious conclusion that beforehand, but is that there's a need for bundled interventions attuned to the specific setting and influencing factors of antibiotic use. Then I said we developed a quantification method for antimicrobial use in Dutch companion animals, because this method was not there yet, because there are very many different units that are used. If you look in papers, and the population data is often unknown, like what the Assoc said, we don't know because it's not corrected for population, because it's unknown. So if you look in papers, it's most of the time, like in Assoc, total grams of active substances, which we are aware that, for instance, for the fluoroquinolones, you need very tiny milligrams, where maybe for tetracycline or doxycycline you need more milligrams, so it's not very good in comparing the different active substances. So some other papers use number of packages or tablets sold, or the number of prescriptions or treatments, which is still, it depends, of course, how big is how many patients you have, or so it's hard to compare between clinics and between countries, or between, well, within your clinic, between next year and previous year and next year, because you don't know if the population was the same. So what we developed is the defined daily dose animal. We already did this in the Netherlands for livestock. And for this, is the numerator is the total animal mass in kilogram that can be treated for 1 day with the amount of antimicrobials prescribed. So for instance, if you have amoxiclav, which is, on the license in the Netherlands is that you can have 12.5 milligram per kilogram twice a day. So 25 milligram is then that you can have 1 day of treatment with antimicrobials, so you can treat 1 kilogram. So that's the numerator. And then the denominator is the total weight in kilogram of the clinic animal population at risk to be treated with antimicrobials. And what we took there is that we estimated that based on the clinic animal population represented by the number of dogs, cats, and rabbits attending the clinic at least once in a specified 3-year period. So we looked at 3 years back, like how many dogs, not if they came more times, but individual dogs, cats, and rabbits did come in the clinic. So they were at risk for getting an antibiotic treatment. And that is what we called the population. So that was the denominator. And then if you can calculate for every antimicrobial that was prescribed, the numerator and the denominator, and then you get a DDDA, so the defined daily dose animal, and a DDDA of 2 implies that the average dog, cat, and rabbit of this clinic has received 2 days of antibiotic treatment in a year time. So hopefully this is clear. So this is what we used for the baseline data and also for the evaluation. So we looked for the 44 participating clinics back, 3 years back, from 2012 to 2015, what they had been using. And what we saw is that the antimicrobial use in these clinics was changing and decreasing from 1.82 to 1.56 DDDA per year in these 3 years. Aminopenicillins most of them with beta-lactam inhibitors account for the largest group of used antimicrobials, about 40%. We saw, and that was for us, it was unexpected. We saw a strong seasonal difference in antimicrobial use, with a peak in July and August. Well, and we assumed that it was more like skin infections, that the dogs were outside and having more itchy and things like that. But actually, we did not did detailed research into that. The distribution of different animal species appears to affect antimicrobial use, because I said we put everything like dogs, cats, and rabbits together, but we saw that in clinics that had more dogs in their population, that the antimicrobial use was higher. And I think that was a bit expected, because I think if we ask people, that we know that dogs on average get more antimicrobial treatments than cats. And again, here, especially the quality of antimicrobials prescribed could be further optimized. And quality is I mean that, like, can we shift it to category D products instead of higher categories? So, and then we the last stage of this project was the development and implementation and evaluation of the stewardship program. And so we developed this program based on the interviews we had, the survey we had, literature, on guidelines that were there in the Netherlands, and of course on the expert opinion of our project team. And I said we had 44 companion animal clinics included. And as we know, stewardship programs are not just one thing. So it was a multifaceted approach, where we had an education of this veterinarians in these clinics on antibiotic resistance, like what is the problem, how does it work, what guidelines are there, what legislation is there, just to, well, refresh, or for some it was quite new, but for some it was a refreshment to see what was there. Then we quantified and benchmarked the antibiotic use by calculating the DDDAs for all the clinics. So benchmarking, we compared them with each other. We asked the veterinarians to fill in 100 forms if they prescribed antibiotics, to fill in what was the clinical diagnosis, what diagnostic did you do, which antibiotic did you give, for how long, and things like that. So we asked that for 100 patients, and we analyzed that and looked at that, and then we went for a visit. We call it with the S team, the stewardship team, like the A team, but then the stewardship team. We went to the clinics to give them individual feedback on the prescription data that we got from them. And we also made an information leaflet for animal owners for in the waiting room, just to make owners aware of antibiotic resistance, and that, sometimes it's better not to prescribe antibiotics, things like that, so to make them aware. So that was what the stewardship program was about. And then after the implementation, we looked before, during, and after implementation to the antimicrobial uses in these practices. And what we saw that, I showed you the baseline data where we also already saw this decrease, but results on top of this ongoing decreasing time trend. We saw a significant decrease of 15% in the total antibiotic use, and also a steeper slope. So I said it was already going down, but there was a going steeper during the program and after the program. A significant decrease of 50% in the category D. Of course, we wanted them, if they use antibiotics, to use more category D, but it was still a significant decrease. But we saw an even higher decrease of 26% in the category C, which is amoxiclav, first and second generation cephalosporins, aminoglycosides, macrolides, and things like that. So we saw there an even higher decrease. And there was no significant decrease in category B, which is third and fourth generation cephalosporins and fluoroquinolones. But to be honest, that was because the usage was already very, very low. So it was quite hard to get a decrease there significant. So the conclusions of our project was that the baseline data before showed already a decrease in total antibiotic use and a shift towards category D. And I think in the Netherlands, we were very hard working on livestock to get a reduction in antibiotics during those years. So companion animal veterinarians were, I think, aware that, well, that there was maybe something going on. So I think that was the reason that there was already a decrease showing. But by the implementation of this stewardship program, we had an even further reduction and optimization of antibiotic use. And we asked the participating veterinarians afterwards, and they indicated the awareness was very increased, and they were very happy with the project. Even the individual feedback, filling in the forms, for them was a lot of work. And for us to analyze it and to go back for individual feedback, it was very effective. It was very well appreciated. However, this was, of course, very time consuming. We did a follow-up where we developed an online course. It was a small course, intensive course with small groups, where there were interactive sessions in there as well. So it's not like a big online course that everybody just can go through. And another 150 veterinarians did that course, so that was quite good. But it stopped now because because of time sake and things like that. So I think we have to revive it for one of our goals in our task. And what we also did is we had a student who looked at topical use of antibiotics, because what I just presented was only the systemic use of antibiotics, but we also had data from topical use, like for eye, ear, and skin infections. And in this data, you actually saw the same decrease of usage, especially in skin products which contained antibiotics. So I think the recommendations from this project was to develop an e-learning module. I said we already did that, but I think we need to do that for EU as well, and also in JAMRAI, which I'm looking forward to it. And we will do that together with ESCMID, with the study group for veterinary microbiology, and ESGAP, the study group for antimicrobial stewardship. Another was to involve stakeholders more. Well, that's also, I think, what we are doing here in JAMRAI. So pet owners, pharmaceutical industry, software providers, veterinary students, and a lot more. But the list is very long. I think we have a very good list now. Develop evidence-based guidelines, because I think we are still lacking a lot of that. There are guidelines around, international ones or national ones, but most of the time they are based on expert opinion and lacking sometimes evidence-based. Within ENOVAT, we had this cost action, this European project. Has been working on evidence-based guidelines, and they are coming out now. So there are still more and more. And look into antimicrobial prescribing quality more. So as I still showed, we've looked at the defined daily dose, which is quantity. But of course, it could be all right if you give fluoroquinolones for a certain infection. That's fine. If this is regarding following the guidelines. So actually we have to link antibiotic usage prescribing with indication. And we are now we started this year a new project where we are doing in the software of the veterinarians, where we try to link the clinical diagnosis with the antibiotic usage, so that we can see whether the quality, what we call it, quality indicators, what we know. So let's see if you prescribe antibiotics, is it following the guidelines? So you can look more into quality instead of quantity only. So, and these are the people, and a lot more people were involved, but Nonke, the PhD student who did her thesis on that, was did the most work, and a lot of other people were involved. And I think the veterinarians were the ones that we couldn't have done without. So that's what I wanted to tell. And so this is thank you. So if there's any questions for me, just let me know. I think I will stop sharing because then.
Thank you so much, Els, for a very interesting presentation. And let's see if we have questions or something in the chat. If not, yeah, we have some. So Angus.
That's very interesting. Thank you. Can you hear me?
Yes.
But the one, so in terms of, say, the software providers across the practices, were they all using the same software so you could kind of pull data easily, or did you have to basically, like, I presume not all software will allow you to extract that data?
Well, what we are working on now is that we work with IDEX Animana, which is in the Netherlands. I think 80% of the companion animal veterinarians use that. But what we do is we link actually databases from antimicrobial substances so that we can calculate very easy DDDAs based on ATC codes, which is an international code. So that's something, and a database with clinical diagnosis. So it's linked to Animana now, but this program we have for the clinical diagnosis is something already developed here at the Utrecht University, which is also linked to other software providers for practice management systems. So it's IDEX Animana is involved in our project, but they wanted us to promise that it's not only them doing this. They don't want to be the only person on the market or on the market that can do this. So they want us to develop something that is that you can apply to other practice management systems as well. So so that's what we are working on.
Okay, very cool. Okay, well done, that's class.
Anna, you have your...
Anna?
Hi, Els. Thanks for the interesting presentation. I was just wondering, as you mentioned, it was quite time consuming for the veterinarians and to participate. How did you motivate or the clinics to participate in the project? What do you recommend to motivate groups of people to participate in such projects? Because it's a constraint I hear often in other studies.
Yeah, well, we gave them a little bit of money, but it was I'm not sure. I think a few €100. So and they had to participate for like 2 years, you know, and have these 100 forums and go to the class, to the courses and things like that. So it was not. If you look at the hourly rate, it was not very much money. But actually, and of course, these are the 44 that we selected. I think we had more that wanted to go because these are the enthusiastic. So it is maybe not representative for the whole the Netherlands, but this is was of course a first try, and they were very enthusiastic, and so I don't think we need to give them money actually to do this, but it is very, if we want to make it for the whole country or very and that's what I hope now in this new project, where it just, if you just put it in your management system, if you have a diagnosis and antibiotic use, and you can just, you know, with one click on the button, it will be calculated. That is my dream. So then it's not a hassle anymore. And on the other hand, I think it could be something in our if we now have for the regulation that you have to report antibiotic use. In livestock in the Netherlands, it's you know, every prescription is going into a system. Now the diagnosis of the clinical diagnosis, the indications are not yet going in this system. But if this is automated, then it's very easy for everyone. And maybe we can put it in our national action plans that it is mandatory, or at least, you know, something that there is a little bit of pressure from policy as well, or from the veterinary association, or but then we have to make it very easy, you know, that it's not a extra thing. So that's why I hope that in this project, which will still go on for 3 years, that it's just, you know, when they put in like this is dog. So with I think it's a cystitis, that cystitis will be picked up or by AI, which is I think maybe even the or that you just have to fill in a mandatory field with because like we now are copying this from the general practitioners in the Netherlands, where they have this ICPC code, so they have to code the clinical indication, and if you don't do that, there will be no invoice. So I want to do this in general in companion animal practices as well, that if you have to fill in something, and it could be maybe coughing, or it could be upper respiratory or something else. We have to see which codes are most are the best, but if you don't put in that code, then there will be no invoice. I think that's the best way to motivate veterinarians to do this. But of course, then the software providers have to work with us on that.
Yeah. Okay. Thanks.
I have a question, a follow-up question related to that, and sorry to jump in, is the motivation and is like benchmarking, if it's possible for the clinics who do well or to compare themselves to others. So maybe that's also something that they can motivate them to be better or to be better than the neighbor.
Yeah.
or how does it work?
Very, very good, because that's how it works actually in the Netherlands for livestock, and there is also a bit of pressure, of course, from policy, but every farmer and every veterinarian is benchmarked. So if you are a high user, you will get like a red flag, and then you said you need to make an action plan to make sure that you're not in the higher user end next year. So what are you going to do to and I'm not like that we have to do everything with pressure, but peer pressure, like benchmarking, could be a good one. It's like, oh, why am I using so much more than my neighbor? Just to make you aware and make it a bit of competitive, I guess. Anne?
Yeah, maybe to follow up on the benchmarking, I was in a recent discussion this week where I heard from farmers, for example, that although peer pressure is a good thing, how do you further work with farms or clinics that already do good, that are green, they're not red, but they still can improve? Because that's often where we are at in some sectors or in the life sector, like it has been better, but you could still do better. And there it's hard to further motivate. At least that is what I heard, because there's nothing in it for them. When they're good and they're not red flagged, then it's good. While there's still an improvement possible in terms of biosecurity or usage of certain antibiotics.
Yeah, and I think then, because of course now we don't have a rough system yet in place, which makes it hard, but then it goes into the details, and well, if they are already doing good, I assume that they find this important to do it well, so then they might be motivated to look more into detail. And as I said, this project that we are doing now, and I know somewhere other countries are working also on this, is that if you get a data drop out of the practice management systems, you can do a lot with it, of course. And we want to make like this dashboard for the practices, that they just can look at their own data, like on a, real time would be great, but maybe if it can do it for every month or every 6 months or whatever, so that they can at least see where they are going, and that they can see whether it's still low or that they are and in the general practices, so in the Netherlands, they have these interventions where they have the benchmark the data with their regional colleagues, where they have this benchmark, and what they want to do is you have to do this intervention every year to look at this data and discuss it with your colleagues and set some goals for the next year on which quality or which indication where you are still maybe well, not the lowest. What are you going to do, or which action are you going to do? So that's what they implementing in general practice in the Netherlands now. So
Good. Anyone has another question? We have time. Otherwise, I still have one.
go ahead.
Is regarding the time consuming of going to the individual practices or clinics for providing feedback, advice, and so on. And I guess you were referring to your stewardship team going there, but is in this project also considered to train them to have their own stewardship team, so they don't need this individual one by one time consuming, just punctual advice.
I think it's a very good thing. And if you look at the human, of course, in hospitals have their A team, their antibiotic team, but in general practice, you see that it's harder because these are sometimes it's only 2 doctors, sometimes it's 10 doctors, and that's the same, I think, for companion animal veterinarians. But what you see more and more, and maybe that's more like for infection prevention, is that you say, okay, we have this nurse who is, well, the nurse responsible for infection prevention, our champion or something like that. And you can do that also for antibiotic stewardship. But it is just in my head, but it's not working like that already. But I think you may have to make someone responsible for it. So what I know for instance, some clinics did is that they labeled the different categories. So on the bottles or on the packages or in the pharmacy, they have like green, orange, and red shelves. Like that, if you go to the red shelf, then one of your nurses would probably say, "Are you sure you want to take the critical important antibiotics?" So these kind of things to implement that in your then you have to be very brave to go for the red things like that. So
yeah, good to know. I don't see any hand raised and nothing in the chat, so we maybe end it here. Thank you so much all for attending this first webinar. Thank you so much, Els, for really interesting and very useful presentation. I would like to say everybody that stay tuned because the next webinar will be organized by our colleagues in IPC. And yeah, stay tuned, and I hope to see you all there. Thank you.
Thank you.
Bye. Thank you so much.
Bye.
Bye.
Thank you.
Thanks,
Bye.
bye.
Thank you. Bye.